In previous classes, we have studied first three classes that belong to antihypertensive drugs. In this class, we will study about calcium channel blocker and vasodilator drugs, and we will discuss first subclass, that is arterial vasodilators. Calcium channel blockers. Calcium channel blockers are the drug used to lower blood pressure, and they work by slowing the movement of calcium into the cell of heart and blood vessel walls, which make it easier for heart to pump and widen blood vessels. As a result, heart does not have to work as hard and blood pressure will get lower down. As we know that calcium is required for the contraction of any muscle, and if lesser amount of calcium is available at a particular position, then that muscle is not contract with full swing as in normal conditions, and muscle get relaxed. And same thing is happen when calcium channel blockers drugs are given, and effect is observed at heart and blood vessels. As a result, lower in blood pressure is observed. These drugs are commonly used for hypertension, that is high blood pressure. Some type of arrhythmia are also treated by using this calcium channel blocker drugs, and in cluster headache, calcium channel blocker drugs are prescribed. Common side effect includes constipation, dizziness, fast heartbeat, that is commonly known as palpitation, fatigue, flashing, headache, nausea, and rashes. Diazoxide is the drug that belongs to calcium channel blocker class. It is based upon 1,4-thiazine ring. It is a benzodiazepine type calcium channel blocker drug. This is the benzodiazepine ring, and that's why it is known as benzodiazepine type calcium channel blocker drug. It is a non-hydropyridine calcium channel blocker used to treat high blood pressure, some type of angina, and certain arrhythmias. It may also be used in hypothyroidism when beta blocker drugs are not effective. It is given by mouth or injection. Next class is vasodilator. Vasodilator are those drugs that open or dilate blood vessels, and they affect the muscles in wall of your artery and veins and prevent the muscle from tightening and wall from narrowing. As a result, blood flow more easily through your vessel, and your heart does not have to pump as hard and reducing your blood pressure. As such, mechanism of action of these drugs is still not known. Common uses of vasodilator drugs are high blood pressure condition, high blood pressure during pregnancy or childbirth, heart failure condition, high blood pressure that affect the arteries in your lungs. That is a condition known as pulmonary hypertension. Common side effect includes a rapid heartbeat, that is commonly known as tachycardia, heart palpitation, fluid retention, that is known as edema, nausea, vomiting, flashing, headache. Excessive hair growth is also observed in person who is taking vasodilator drugs. Joint pain and chest pain are the side effects commonly observed in patients who are on vasodilator drugs. Arterial vasodilators. These medications are preferably have dilation effect on arterioles only. They do not have effect on venous system. Drug in this subclass is Hydralazine, Minoxidil, and Diazoxide. Hydralazine is a arterial vasodilator drug. It is a Hydralazine derivative with antihypertensive effect. Hydralazine exerts vasodilator effect through modification of contractile state of arterial vascular smooth muscle by alerting intracellular calcium release and interfere with smooth muscle cell calcium influx. That means it interfere with the release of calcium, and as we know that calcium is necessary for the contraction of any muscle. If sufficient amount of calcium is not available at a particular site, then forceful contraction is not observed, and that particular muscle get relaxed and effect is observed. These drugs are commonly used to lower the blood pressure, and which is commonly helpful to prevent stroke, heart attack, and kidney problems. Side effects associated with these drugs are headache, pounding or fast heartbeat, loss of appetite, nausea, vomiting, diarrhea, and dizziness. The structure of this drug is given here. Now come to synthesis. Synthesis of hydralazine is started by using 2-carboxy-benzaldehyde. It reacts with hydrazine monohydrate and ethanol is used as a solvent. Refluxing this mixture gives rise to halazinol, and this compound further refluxed in presence of phosphorus oxychloride gives rise to 1-chlorothalazine, and it further reacts with hydrazine monohydrate gives rise to hydralazine. There is a short trick by which we can easily guess the starting materials and intermediate steps. If we divide this drug in three major sections, we can easily find out what section comes from which part. This section comes from this hydrazine hydrate. This section comes from starting material, that is carboxybenzaldehyde, and this section again comes from hydrazine hydrate. By closely observing this structure, we can write synthesis very easily. Minoxidil. Minoxidil is a member of piperidine and aminopyridine that contain pyridine 2,4-diamine 3-oxide substituted by piperidine at 6th position. Numbering start from this position 1, 2, 3, 4, 5 and 6. That means at 2 and 4 diamine is present, at 3rd position oxide is present, and on 6th position piperidine is present. It is commonly used as a vasodilator agent and antihypertensive agent. Nowadays, it is commonly used as a option for the treatment of male pattern baldness, and it is given topically to the patient who have male pattern baldness. Next drug is diazoxide. Structure of this drug is given here. Diazoxide is a direct rapid acting vasodilator that decreases total peripheral resistance with a reflex increase in heart rate and cardiac output. This condition is countered by taking beta blocker therapy. Diazoxide is a benzothiazide, that is the SS dioxide of 1,2,4-benzothiazine, which is substituted at the 3rd position with methyl group and chlorine group at 7th position. Numbering start from this position 1, 2, 3, 4, 5, 6, 7 and 8, 9, 10. This drug is commonly used for hypoglycemic condition generated due to hyperinsulinism. Whenever insulin is given in excess, then hypoglycemia is observed in diabetic patient, and that produces severe life-threatening condition. This condition can be treated by using this drug. They also reduce blood pressure in hypertensive emergency condition and malignant hypertensive conditions.